My name is Catherine Williams, and I'm going to be doing a presentation on rheumatoid arthritis. So, what is rheumatoid arthritis? It's a chronic systemic inflammatory disease that mainly affects the peripheral joints. It causes inflammation of the synovial membranes, and it's associated with pain, heat, stiffness, swelling, and eventual total joint destruction. Who does it affect? So it is a worldwide problem. It doesn't pick and choose who RA affects. It attacks all age groups from infants to the elderly, but the incidence usually rises with increasing of age. Genetics can be a factor. There's an increased prevalence associated with a subset of DR4 alleles. The non-genetic risk factors is an influence of sex. Women are 3 times more likely to be diagnosed with rheumatoid arthritis than men. Smoking can be a factor, and infectious agents and viruses, because bacteria is found in the synovial fluid in patients diagnosed with rheumatoid arthritis. The pathological process, the synovial lining of the joint capsule becomes inflamed and congested with T lymphocytes, B cells, macrophages, and plasma cells. The lining then thickens and forms a pannus that overgrows, invades, and destroys adjacent cartilage and the bone. So right here, this picture shows the difference between the healthy joint and an arthritic joint. So it shows the joint capsule and the synovial membrane, and then here it's showing the arthritic joint where the macrophage, the T cells, and the plasma cells are all invading the synovial membrane, causing all the swelling and inflammation of the joint. Clinical manifestations of rheumatoid arthritis in the early symptoms, which makes it very hard for rheumatoid arthritis to be diagnosed. There are symptoms of fatigue, a low-grade fever, weight loss, and myalgia. And those same symptoms can actually be seen in lupus and other diseases. The involved joints are swollen, warm, tender, and may have effusions. And patients often experience prolonged morning stiffness that usually lasts for an hour or longer. In late symptoms of rheumatoid arthritis, you see total joint destruction and deformities. And in this photo, it shows the early, intermediate, and late symptoms of rheumatoid arthritis in a hand. And it shows how destructive the disease can be to the joints and how terrible the deformities can be and how important it is to catch rheumatoid arthritis in its early stages. For the diagnosis, there's not just one thing to diagnose rheumatoid arthritis. There's looking at the characteristics, signs, and symptoms, which is the fatigue, the myalgia, the pain, the swollen joints. You're also looking at the joint involvement, symmetrical synovitis of the small joints, which is swelling of the synovial fluid, which can be felt. You're also looking at lab data and x-rays. An x-ray can show the synovial fluid in the diagnostic reading. In the lab values, you can look at the rheumatoid factor. With rheumatoid arthritis, in the late stages, it can show a positive or high rheumatoid factor, but sometimes in the early stages, it can come back negative. You're also going to look at acetate. The acetate will be abnormal and can also be a sign of rheumatoid arthritis. You also look at the duration of symptoms. If the symptoms have been lasting longer than 6 weeks, it's another clinical manifestation of rheumatoid arthritis and a way to diagnose. For treatment, the main goal, since there is no cure, is just management. So the main focus is reduction of pain and discomfort. So you want to catch symptoms early so you can prevent the deformities and loss of normal joint function. You want to maintain normal physical, social, and emotional function and the capacity to work and the capacity to use your joints in everyday use. So non-pharmacologic treatments are reduction of joint stress, so resting, relaxing, physical and occupational therapy, the use of assistive devices to take weight off of the joints, like a cane to take weight off of a knee, or a walker. Another way is healthy diet and exercise. Sometimes just weight loss and diet can help reduce the strain on your joints and can help relieve pain. The pharmacologic treatments is the use of NSAIDs. This treatment's used in the early phases and usually helps reduce joint pain and swelling and helps with improvement in function. There's also glucocorticoids. These are used to treat acute exacerbation of the disease. And there's also the use of biologics, and these interrupt the pathogenesis of the disease. In other forms, there's also surgery, and you can have joint replacement surgery, and you have reconstructive surgery, which is done in the early stages to help save the joint and help maybe delay the deformity or help prevent a deformity in a hand or a foot. And also there's total joint arthroplasty, which can cause amazing improvements in people that have severe degenerative forms of this disease in their joints. And that is all. Any questions?